Hello everybody, Patrick T-Volt here, and we're going to make a video today on my first aid kit, trauma kit, general medicine kit, and make a video about it, talk about what I pack. So when I pack my medic bag, I think of it as airway, breathing, bleeding, shock. So as far as airways are concerned, first I have, these are called J tubes, and they're different sizes. My next is a nasal pharyngeal airway, various sizes, with some lubricant because that goes through the nose. And then a King LD airway kit. And then I have some 8 French, or some endotracheal tubes. And of course I have a laryngoscope set. And of course I have a resuscitator, a pocket bag valve mask system. So that's basically airway. So the next component is bleeding. So of course I have 3 tourniquets for bleeding, 3 compression dressings for bleeding, some gauze, some Curlex, and some hemostatic therapeutics for bleeding. And of course I have a Band-Aid pack for bleeding. And down the line I have a cauterizer here, and a suture kit with both lidocaine without epi and lidocaine with epi, depending on where the bleeding is occurring at. And of course you can see that's a component of bleeding. Now the next part is shock. For shock, I have 2 bags of IV fluid sets set up in here. This is a siphon pump, which can work as a pump suction. That should go into airway breathing part. And another thing that I have for shock, for anaphylactic shock, is 1 milligram per ml epinephrine. And this is my suture kit in here with sutures of various sizes. So then that's shock. Of course, with shock, you want to keep the patient warm, so warm blankets. Another type of shock is volume. So for burns, you want to take care of that with some burn dressings. And this is a big multi-trauma dressing. And I have 2 big tegaderm dressings here to hold things in place. Next would be fractures. And what I have in my aid bag are some SAM splints. And I have various ways of holding it. I have these triangular bandages to hold them, 3 of them, 2 SAM splints, some elastic bandages, hold everything in place. So going down the line now. Okay. So now I'm just going to go what I pack in my bag. Those are the big things. So of course we're just going to start from back here. 2 IV sets, a multi trauma dressing, 1 each. Cold blankets for shock. 3 of these real fancy field dressings. Burn dressings here. Petroleum gauze, 2 each. 3 triangular muslin dressings. Hemostatic gauze here. And here's some medicine that doesn't belong there. Garbage. And stop bleed, I have a couple in here. Some 4x4s, 2x2s, Tefla. Silvadene cream, which is good for skin wound, open wounds that are infected. And what here is the Dermabond. These are good for minor lacerations that you just want to close up. Going around, I already talked about my Tegaderm. I have some moleskin here, as you can see. Doesn't look pretty, but it's great for the feet. This is my suture kit here, minor surgical kit, very minor, but inside it I have some tools and some scalpels, disposable scalpels, and suture material inside here of various sizes. I have some gloves here, my stethoscope, my blood pressure cuff. Now this is a dental kit I got commercially. I'm not a dentist, but it's a full-blown dental kit. And it comes with this book here, Where There Is No Dentist. It's a good kit. Going up in the middle now, I have various needles, small gauge needles for injection, and one 30cc syringe. Of course, I have writing material and something to write with. Do have a EpiPen. Of course, these are the tourniquets I talked about. I got 2 chem lights, and these are the modern day version of field medical cards. Alcohol pads, iodine pads, tongue blades, portable cauterizer. I have some tape, a pulse oximeter, as you can see. These are 14 gauge for needle decompression for hemothorax, or pneumothorax, I should say. I talked about my dental kit. These are some cotton tip applicators. What I have here are some iodine packing. This is some povidone iodine clean. Of course, I talked about my lidocaine with epi and lidocaine without epi. Over here I have just some 3cc normal saline. These are some small punch biopsies. These are the chest seals. I have 3 each for a chest wound. This device is to cut off a ring. It doesn't work on titanium, I don't think, but other rings it can cut off for a swollen finger. This is with Airway, my 8 millimeter endotracheal tubes. This is a bag valve mask system. Since this is an Airway, this is albuterol. and another rescue inhaler. And I have my pump here, which can work as a pump. These are J tubes. This is the King LT. This is a laryngoscope set. And these are J tubes, or nasopharyngeal tubes, I should say, with some lube. And of course, I have some bacterial wipes and some Lysol cleaner. The other system that I have is just this venom extractor, just in case, and some cleansing alcohol. So we're going to go around to the general medicine. As you can see, I've cut back on a lot of duplicate stuff. Now, as far as the medications are concerned, well, go back to, I have a staple system here, a skin stapler removal. Now let's talk about some medications and what's on this side. Over here I have some doxycycline antibiotics. Over here I have some steroids. Some eye drops. Some ear and eye drops. This is far-fetched, but I have some potassium iodide tablets. I have some levofloxacin here, which is an antibiotic. Fluconazole, which is for yeast. And this is a water pill, Lasix. 100 milligrams of a water pill. Of course, I have a Narcan. And this is my epinephrine, adrenaline. It's 1 milligram per ml injectables. This is Septra clotrimazole tablets. And this is Flagyl, metronidazole. This here is a beta-lactam. It's a cephalosporin, cefexime tablets. For pediatrics, I do have some Augmentin liquid. For injectable Rocephin or ceftriaxone injections, 1 gram. And 3 zithromycin packs. They're 500 milligrams, 3 tablets each. And this is checking. Not really necessary, but I keep it on me. This checks for deep tendon reflexes. Of course, I have a light. It takes AAA batteries, and it works. And so, what I plan on doing is putting all my meds. As you can see, they're a little bit flimsy, so I'm going to pack them in here and pack them away nice. And I missed these over here. I have some, these are some good boo-boo wounds. Some Tegaderm here, which is nice. And underneath here I have some Steri-Strips. So Steri-Strips are good for wounds, minor wounds. I'm just going down the line here. And I try not to have too many duplicates, but yeah, I have 2 pairs of scissors, Band-Aid, extra Epi auto injector, epinephrine. And this is just a simple eyeglass kit. You never know. Alcohol pads, iodine, and of course some nightlight sticks. Chem lights is what we used to call them in the military. So this is basically my first-hand medic bag. It's not really traumatic trauma or general medicine. It's just a good bag to have for the neighborhood. One thing I don't have are sugar and salt for hypoglycemia. But I mean, I can't have everything. But have what I have. Okay. Thank you, everybody.